Individual action of each extraocular muscle is dependent upon its attachment in orbit. All recti originate from common tendinous ring in back of orbit, and get insertion on respective side of globe, in front of equator. Superior oblique originate from back of orbit, it then moves through a pulley and changes its direction. It is inserted on superior aspect of globe, behind equator. Inferior oblique originate from medial aspect of orbit. It moves on lower side of globe and get inserted on inferolateral aspect of eye. These attachments affect individual movement of each muscle, when they are acting alone. Superior rectus elevates, medially rotates and intorts the eye. Inferior rectus depresses, medially rotates and extorts the eye. Inferior oblique produces elevation, lateral rotation and extortion of eye. Superior oblique depresses, laterally rotates and intorts the eye. Medial rectus is responsible for medial rotation, and lateral rectus produces lateral rotation of eye. For easy remembering, both recti medially rotate the eye, and both obliques laterally rotate the eye, when acting alone. On other hand, both superior muscles produce intorsion of eye, and both inferior muscles are responsible for extorsion of eye, when each muscle is acting alone. In third nerve palsy, all extraocular muscles get paralyzed except lateral rectus, supplied by sixth nerve, and superior oblique, supplied by fourth nerve. That is why, these remaining two muscles get chance to act alone, and move the eyeball down and out. In normal scenario, extraocular muscles act together to produce different extraocular movements, which are different from their individual action. It depends on their alignment in orbit, in different axes at different angles. In orbit, superior and inferior recti are directly inserted on globe in front of equator, while obliques move forward in orbit, and change their direction to get insertion on globe. Superior oblique is inserted behind equator while inferior oblique is inserted on inferolateral aspect of eye. When one eye is rotated laterally along vertical axis, superior and inferior recti of that eye come to lie in direction of visual axis. At this angle of outward gaze, their primary function is more enhanced, which are elevation and depression respectively. Simultaneously, other eye also moves and it rotates medially. Due to this medial rotation, superior and inferior obliques of this eye come to lie in direction of visual axis. At this angle of inward gaze, their primary functions are more enhanced, which are depression and elevation respectively. That is why, when we are clinically testing extraocular movements by making H. Superior rectus elevates and laterally rotates the eye, that is, upward and outward gaze. Inferior rectus depresses and laterally rotates the eye, that is, downward and outward gaze. Inferior oblique causes elevation and inward rotation, that is, upward and inward gaze. Superior oblique causes depression and inward rotation, that is, downward and inward gaze. That is why, in fourth nerve palsy, apparently both eyes appear normal. But when patient is asked to follow the command, affected eye cannot look down and in, because of superior oblique paralysis. Don't forget to like this video, and subscribe to my channel to get new updates.